After so many failed votes, it's clear we need to try something different. What the Senate is doing isn't working for either party and isn't working for the American people. Democrats have said we must address the health care crisis, but Republicans have repeatedly said they won't negotiate to lower the health care costs until the government reopens. So let's find a path to honor both positions. Democrats would like to see an end to this shutdown, and we want to respect Leader Thune's desire not to negotiate on ACA until after the government reopens. Therefore, we'd like to offer a simple proposal that would reopen the government and extend the ACA premium tax credits simultaneously, and then have the opportunity to start negotiating longer-term solutions to health care costs. Let's do all three. I've spoken with my caucus, and Democrats are offering a very simple compromise. Democrats are ready to clear the way to quickly pass a government funding bill that includes health care affordability. Leader Thune just needs to add a clean one-year extension of the ACA tax credits to the CR so that we can immediately address rising health care costs. That's not a negotiation. It's an extension of current law, something we do all the time around here, as we all know. But we also offer this. Let's create a bipartisan committee that will continue negotiations after the government reopens on reforms, ahead of next year's enrollment period, to provide long-term certainty that health care costs will be more affordable. This proposal reopens the government and ensures working families who are shopping right now for their health care get certainty and financial relief. While open enrollment has begun, insurers can update their rates after we pass a simple extension of the tax credits. With this approach, we do not negotiate health care in the shutdown, as Leader Thune has maintained he wishes, and the American people get the tax credit extension they want. That is what many of our Republican colleagues have floated over the last 6 weeks as a compromise, a one-year tax credit extension and reforms to the credit beyond that. We will agree with the Republican request not to start negotiations until after the government reopens. All Republicans have to do is say yes to extend current law for 1 year. It makes sense. And since what we're proposing is only a simple extension of current law, the Senate could do this within a few hours. This is a reasonable offer that reopens the government, deals with health care affordability, and begins a process of negotiating reforms to the ACA tax credits for the future. Now, the ball is in the Republicans' court. We need Republicans to just say yes. I yield to Senator Peters.
Thank you, Leader Schumer.
Senator from Michigan.
Thank you, Madam President. Madam President, Republicans have repeatedly said that they will not negotiate reforms to the health care law credits until the government reopens. I will tell you right now that all my colleagues on this side of the aisle definitely want to open government, and we want to do it as soon as possible. We are also willing to respect Leader Thune's desire to negotiate after the shutdown. So Democrats are offering today a very simple, straightforward compromise. And if Republicans accept this, we could open the government today. Wouldn't that be fabulous? Show that we can come together with a common sense, bipartisan compromise and open government. All we have to do is have a one-year extension of a clean bill that's law now, it's expired. It's just an extension of an existing law dealing with tax credits. And over the next year, we can figure out a long-term solution to the health care challenge that we're facing as a country. This proposal opens the government and ensures that families who are shopping right now for their health care can get immediate financial relief at a time when costs are driving families to make incredibly difficult financial decisions. And we believe that while we're trying to figure out a long-term solution to the healthcare crisis, people should not be penalized. People should not be suffering. Give the relief that they need now, and over the next year, we'll work together to find a more comprehensive solution. We know that right now our nation is experiencing a healthcare crisis where costs are skyrocketing and too many Americans are risking losing their coverage. Too many Americans are struggling to choose between food or gas or healthcare. And it's not just Americans in blue states, let's be clear. Families in every state across the country are paying these prices. Every one of us have families that are experiencing this now in our states. But we can take action today to give our constituents some immediate financial relief and prevent them from being priced out of the insurance market. We all want to end the shutdown. We want to ensure that government services can continue, and we want to ensure our hardworking federal employees get the pay that they have earned. But Democrats have made clear since day one that in order to get the votes that Republicans need, we must address the health care crisis. Because the American people have made it clear they want Congress to take action on this issue, it's literally life or death for far too many American families. I know many of my Republican colleagues want to work on this issue too. I've had conversations with so many of my colleagues on the other side of the aisle who want to try to figure out how we fix this. But they've said repeatedly we won't negotiate until government reopens. Leader Thune has said, quote, "Give us the votes to open up the government. Then we will have a conversation about some of these issues that you want to discuss." And I think health care is certainly something we are anxious to all talk about, end of quote. And perhaps most importantly, even President Trump has said he'd be happy to work with Democrats on health care policies, but only once the government is reopened. Well, I agree with my Republican colleagues. It's not realistic to reform a major health care policy in just a few days. That's not going to happen. And I respect Leader Thune and President Trump's desire to work on this when the government is reopened. And I'm willing to compromise on that. My colleagues are willing to compromise this, and it's something that can be done today if we need to. But our Republican colleagues have to be willing to compromise too. Compromise is a two-way street. And they have shown us that and we want them to show us that these are not just empty words, that they really are willing to compromise, and they do want to take action. So that's why we've put forward this very simple proposal. Extend the tax credits for 1 year. We are not asking to make any major changes to the current law. Just extend that to protect people who are suffering right now and are hurting. We're just asking to keep the credits in place for 1 year so that families can see some immediate financial relief from the costs that are going through the roof, so that they can make important decisions about buying their health care right now during open enrollment. This is live. People are dealing with this situation as we speak. We can fix this. If we care about making sure families can afford their health care, we should all agree on that. We should get 100 votes here for people to say we're going to do everything we can to protect health care for Americans. And we can do that right now. And we can open up government right now. We can pay employees. We can move this country forward if we do that. All we need is a very simple extension of a law that's already existed for some time. We know that from the start that any deal will ultimately have to be a compromise. It doesn't have to be unanimous. There'll be likely folks on both sides that may feel uncomfortable with this, and I get that, and that's the way this place works. But our proposal would try to work in a bipartisan way by creating a bipartisan committee that will continue negotiations on reforms ahead of next year's enrollment process. So we're not pulling the rug out from underneath families. We're going to do it ahead of time so folks know exactly what to expect going forward. So I'm telling you now, Madam President, if we vote for this compromise today, we could open up government. This could all be behind us. Families could get some certainty for their future for the next year while we look at long-term solutions. The government can open, but it takes all of us just to say, we're willing to compromise for the good of the country. My colleagues are standing here saying we are willing to compromise for the good of the country. I just hope my Republican colleagues agree.
Mr. President, or Madam President.
Senator from Vermont.
There's a lot of focus on what divides us, but the real opportunity here is what unites us. We're having a contest here with this shutdown where our side is very concerned about what happens to these tax credits. Your side is very concerned about using a shutdown as a tactic. I think we both have pretty valid arguments. And one of the reasons I think there's merit in our position is the reality that once the December 31st deadline arrives, people literally are going to lose health care. So what unites us? Both sides really do want to have all of government paid, and we want to be reopened. And both sides, I believe, want to make certain that the people we represent continue to have access to health care, that the health care they had in 2025, they're going to have in 2026. That won't happen unless we resolve this. And given the time crunch, the only way, as a practical matter, we can do something that helps the people you represent and helps the people I represent is extend what we have for another year. So it's not an overreach on the part of, say, folks who want a single-payer health care system. It's not overreach or diminishing any concerns folks on the Republican side, and by the way, on our side, have about the cost of health care. We are in a practical crunch where unless this United States Senate acts, the people we represent are going to lose health care. That's the fact. That's just the fact. It's the way it is. And we've talked about how those premium increases are going to spike. So what do we do in this situation where Leader Thune, who we trust, who we respect, is taking a position that we won't have discussions until we reopen government? Why do we object to that or have cautions about that? We trust Leader Thune. We trust our Republican colleagues. But what happens after it goes out of the Senate? We have no guarantee whatsoever it'll be taken up in the House at all. So the question that a farmer in Vermont would ask me at the end of any agreement is, Peter, what does this mean? Will I get my health care in 2026? And unless we have it where it's going to get a vote with some support from our colleagues in the House, the answer is I don't know, but I hope so. So we find ourselves with January 1st here, and that farmer, that small business person, not having health care. And again, this is the lament I have. What we're trying to do here, the folks who are going to benefit or not suffer are Republicans who voted for Trump and Democrats who voted for Harris and independents who didn't like either candidate at all. So we have an opportunity. And actually, we're the only people in the United States of America who have an opportunity. The only people, it's us, who've been entrusted by the people who we represent with their vote to solve this problem. And what I think is being proposed has a quality that's rare around here. It's restraint. We're not trying to overreach. We're just trying to say, maintain the status quo so that the folks in America who are getting their health care with the help of some tax credits will continue to have that health care in 2026 as they have it in 2025. So I hope we can come together for this temporary fix. And by the way, I just want to say the cost of health care is exploding. And we have an obligation, if we want to maintain access to health care, to address that. It's not a solution to deal with the health care crisis by taking people off of health care. They still get sick. So when our leader says that we want this bipartisan committee to address the cost of health care, we are sincere about that, because the biggest threat to the continued access to health care is the exploding cost of health care. I yield to my colleague from Wisconsin.
Madam President.
Senator from Wisconsin.
I rise today to echo, to underscore, to emphasize what my colleagues have just presented. This is our path forward. This is how we reopen the government and lower health care costs for millions of Americans. This is what compromise looks like. Look, if I had my way, we would be making these enhanced premium tax credits for working families permanent. But I understand that we can't get everything that we want. That's how compromise works, and that is what our constituents expect that we do when we come here. I know that giving relief for the 275,000 Wisconsinites who are shopping online at healthcare.gov for healthcare as we speak, I know that this relief is urgent, just like it's urgent that we reopen our government. I've had so many conversations with my Republican colleagues here in the Senate. I know that so many of them have expressed privately that they are supportive of a one-year extension of Affordable Care Act tax credits. You know, they're hearing from their constituents who will no longer be able to afford their health care also, just like we are. So I hope my Republican colleagues can join us in voting to pass this proposal so that we can finally put this shutdown behind us and allow 22 million Americans to rest easier, knowing that their health care costs are not going to double, triple, or even worse. That I yield to the Senate.
Madam President.
Senator from Arizona.
Madam President, for more than a month, I've been here in D.C. fighting to keep health care costs from spiking for my constituents. And for more than a month, I've been hearing from people I represent about what their health care costs now and what it will cost if these tax credits are allowed to expire. People like Leslie from Buckeye, who's a diabetic and whose premium is about to go from $600 a month to $1,000 per month. And people like Jessica from Yuma, her and her husband currently pay $560 per month for them and their 3 kids. That's going to go to $3,100 per month if these tax credits are not extended. And for more than a month, I've been waiting for the President or Republican leadership in the Senate to sit down with us and try to figure this out, or even show that they care about the millions of Americans in our states who are in the same boat, people like Leslie and Jessica. Now, that hasn't happened. The President, as far as I can tell, has spent about 1 hour in the Oval Office with congressional leadership on this issue. 1 hour in 37 days. He has spent more time talking about his ballroom and on 2 overseas trips and at a costume party at Mar-a-Lago and, of course, on the golf course. The House of Representatives, they've been on a 7-week paid vacation. They are not even pretending to care about these rising health care costs. And the Senate, not much better. Week after week, the leadership of the Senate breaks for a long weekend, all while Americans are suffering. And they're suffering even more because Donald Trump is using them as pawns in this fight. He's still trying to illegally withhold SNAP benefits from hungry Americans, including children, to use as leverage. Donald Trump's official position on the government shutdown is that he will let hardworking Americans go hungry until we give in to his demands to let health care premiums go up dramatically for millions of Americans. Now, is that the position of my Republican colleagues? I keep hearing from many of you that you want to do something about this, but you say you can't negotiate. Not now. So let's just lay it out here. We need to extend government funding to reopen the government, but we also need to extend these tax credits so millions of Americans can actually afford their health care. So let's do both. No gimmicks, no changes. Let's reopen the government. But we can do that knowing that Jessica and Leslie and a whole bunch of other people that we represent can take their kid to a doctor and fill their prescriptions for another year. There is no reason why we can't agree on this. If you want to reopen the government and you want to help keep health insurance premiums from spiking, then let's do it. But if you say no, if you say you can't vote for something like this, well, let's just be honest about it. Tell the Jessicas and Leslies in your state that they're not going to be able to afford their health care anymore. Tell them that Donald Trump thinks that they should go to a food bank for groceries so they can have something to eat. Now, Madam President, I also think we need to be perfectly clear about why we are here and how we got here. All of this we have discussed over the last month is because Donald Trump and Republicans in the House and Senate wanted to give a big, giant tax cut to the wealthiest Americans, a $4 trillion giveaway. And again, Madam President, we want a deal. We can choose to fix this so Jessica and Leslie and millions of others can afford to have basic health care. I yield the floor.